Today, we will discuss gunshot wounds, but really quickly. Are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. A gunshot wound, GSW, is an injury caused by a bullet or other projectile fired from a firearm. The severity of a gunshot wound can vary significantly based on several factors, including 1. Caliber of the bullet. Larger bullets typically cause more damage. 2. Distance. The closer the shooter, the more energy the bullet retains, increasing the injury's severity. 3. Location. Wounds to vital organs or major blood vessels are more serious. 4. Type of firearm. Different firearms can produce different types of wounds, e.g. handguns versus rifles. Types of gunshot wounds. Penetrating wound. The bullet enters the body but does not exit. Perforating wound. The bullet passes through the body, entering and exiting. Symptoms. Bleeding can be external or internal. Pain varies in intensity based on the injury. Shock may result from severe blood loss or trauma. Difficulty breathing, especially if the chest is involved. Treatment. Immediate medical attention is crucial. Treatment can include managing bleeding, surgery to repair damaged tissue, and addressing any complications. If someone gets shot, here's what to do in simplified steps. 1. Call for help. Dial emergency services like 911 immediately. 2. Ensure safety. Make sure the area is safe. Avoid putting yourself in danger. 3. Check responsiveness. Talk to the person. If they are unconscious and not breathing, start CPR if you know how. 4. Control bleeding. If there's bleeding, apply pressure with a clean cloth or your hand. If the bleeding is severe, use a tourniquet if you can. 5. Keep them calm. Reassure the person and try to keep them still until help arrives. 6. Don't remove the bullet. Do not try to take out the bullet or any objects stuck in the wound. 7. Monitor their condition. Keep an eye on their breathing and consciousness until help arrives. Stay calm and focused, and let the professionals handle the situation when they arrive. In the hospital, here's what doctors and nurses typically do to save someone who got shot. 1. Assess the situation. They check the person's vital signs, like heart rate and breathing, and look at the wounds. 2. Control bleeding. They may apply more advanced pressure or use special tools to stop any heavy bleeding. 3. Fluids. They start an intravenous IV line to give fluids and blood if needed. 4. Imaging tests. They may perform X-rays or CT scans to see where the bullet is and how much damage has been done. 5. Surgery. If necessary, they perform surgery to repair any damaged organs, blood vessels, or bones. 6. Pain management. They give medications to help reduce pain and prevent infection. 7. Monitoring. After treatment, they keep a close watch on the patient's recovery in a hospital room or intensive care unit. The goal is to stabilize the person and help them heal. Here are some common medications that may be used in the treatment of gunshot wounds. 1. Pain relievers. Acetaminophen, Tylenol, used for mild to moderate pain. Non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, Advil, Motrin, or ketorolac, Toradol. 2. Opioids. Morphine, often used for severe pain management in the hospital. Fentanyl, another strong pain reliever, sometimes used in emergencies. 3. Antibiotics to prevent or treat infections. Cefazolin Ancef, a common choice for prophylactic use. Piperacillin tazobactam, Zosyn, used for more serious infections. 4. Anticoagulants. If there's a risk of clotting, medications like heparin to prevent blood clots in certain situations. 5. Fluid resuscitation. Normal saline or lactated Ringer's solution, used for IV fluid replacement. Tetanus prophylaxis. Tetanus toxoid, given if the patient's vaccination is not up to date. These medications are typically administered based on the specific needs of the patient and the nature of their injuries. Countries with the highest rates of shootings typically include those with high levels of gun violence, often linked to factors like crime, conflict, and lax gun control laws. Here are some countries known for high rates of gun violence. 1. United States. The U.S. has one of the highest rates of gun-related deaths among developed nations, largely due to homicide, suicide, and mass shootings. 2. Brazil. High rates of gun violence are often associated with organized crime and gang activity. 3. Mexico. Drug-related violence contributes significantly to the high number of shootings. 4. Venezuela. The country has high homicide rates, with many deaths attributed to gun violence. 5. South Africa. Gun violence is a major issue, often related to crime and social unrest. 6. Colombia. Despite improvements, gun violence remains high, linked to drug trafficking and civil conflict. 7. Jamaica. Known for high rates of gun-related homicides, often connected to gang violence. These countries often face complex social, economic, and political challenges that contribute to gun violence. Now you need to watch my video on strokes or have a look at heart attacks.